Hi, hello everyone, and welcome to this very, I think, challenging session on COVID-19 Unmasked, a clever use of the title. We're all getting used to wearing masks. Many countries have had it for decades, but for a lot of us, wearing masks around the world and around our communities is a new experience. Now, I have two fantastically informed and great guests with me. I've got Dr. Dennis Bauer, a principal research scientist in transformational bioinformatics and internationally recognized expert in machine learning and cloud-based genomics. She is coming from Sydney, so I know it's nighttime in Sydney for you, Dennis. We're very, very, very grateful, and your background indicates that the light is closing in. So we'll wish you good night in 40 minutes' time, but thank you. And then we have also sympathetically to Gianluca Pettini, and he is Senior Vice President and President of Specialty Diagnostics Group, coming to us from Boston. So you're getting the morning, and Dennis is getting the evening, and I'm getting the middle of the day here in London. But thank you to the two of you for joining this conversation. Talking about coronavirus is not an easy subject for any of us. Everybody knows somebody affected in one way, shape, or another. And some people are more consumed with fear than they are with the reality of the virus. So I just want to start by maybe going to you, Dennis, if I may. First of all, Sydney, you're in Sydney, but we read a lot about Melbourne, and we read that Melbourne is going through particularly stressful time. Just give us the mood of Australia, let alone the reality of how you see the disease in Australia.
Yeah, I think, and the good news, Australia really has come together and reunited in, the crisis that we're seeing here. Melbourne, unfortunately, copped the brunt in that they had slips in the system, and the virus has got a foothold in there and unfortunately spread. But the government really reacted quite quickly as well in putting in lockdown. And on one hand, that stopped the spread, but of course that affects the mood as well. So I think as Australians, we need to come together and really support our, fellow Australians in Melbourne, and particularly in Victoria in general. And I think we've done that. So, I'm hoping that the mood is still stable enough and that we can get out of this quite quickly together.
If you were to pick on maybe one, maybe two aspects of the difference between the impact on Melbourne and where you are in Sydney, in terms of either people's behavior or the transmission of the virus, what would you focus on?
Oh dear, I think in Sydney, it looked for a while that we would follow Melbourne's trend in that it was on knife's edge. And it probably still is. So therefore, I don't think it can be put down to particular behavior that Sydney behaves differently to Melbourne. I think it was, sheer luck, a chain of events that got managed, that the virus got out of control in Melbourne compared to Sydney. So I think we all have to be vigilant at all times, including, Queensland as well, so that it won't go down a similar route in any regions in Australia.
Gianluca, if I may turn to you, you're in Boston, but you've had heavy involvement in World Economic Forum forums on health, and you understand both the scientific information and data, but also the health implications very clearly. So you're in the US, and the US is not now the worst case performer. I mean, per 100,000, it's certainly not, but in terms of rising cases continues to be a problem. From where you sit looking across, you're in the northeast of the United States, which seems to be doing better, the middle states. Why is that change taking place?
Well, let me start by saying that I'm incredibly happy to be here today. I had the opportunity to participate to various Enactus World Cup and events, especially in China. When I was in China, I definitely missed the face-to-face and engaging with all the students. So I want to say hi to all of them and thanking them for being here, seeing us today. As far as COVID-19, I'm with a company called Thermo Fisher Scientific, and we have been in the middle of the response to COVID-19 as we manufacture solutions to test for COVID-19. And so I'll start there because you highlighted it. Data is critical. And when we look at data across the world, we have more data, but we don't have enough data. And I give you an example. Less than 5% of the world population has been tested to date. And out of that, we know that there's 27 million of positive cases worldwide. Now, to do a comparison is like putting 100 people in a room, testing 5 people, and saying there's 2 positive, so we have 2% of the total population positive, and maybe you have 1 death, and so you have 50% death rate. And this statistic is very flawed, and I'm sure Denise can elaborate on that as she works on data. But the lack of data or the lack of comprehensive data and inferred data has been a challenge. So a long answer to your question, yes, the Northeast seems to be doing better, and lockdown, social distancing, utilization of mask is containing the spread of the disease, but we're far from having a great understanding of the prevalence of the virus. Think about the fact that 40 to 45% of infected individuals are asymptomatic. And so how hard it is to say exactly how many people had COVID already worldwide is a big challenge that then obviously impact all the statistic and the response of many countries. So we've seen the countries that have done better to be very targeted in testing and taking very targeted measures. I think the US is doing well at that. They continue to improve and iterate and invest on that. And definitely we need more testing and better data in order to continue to respond to the current crisis. By the way, it's the largest health crisis we had worldwide, I would say probably since our history. The various countries are doing a lot of investment. I'm encouraged by the trend and the approach of various of the country that we're working with.
So let's take a few minutes on perspective maybe, and you two are the experts on data. So you mentioned, Gianluca, that there have been nearly 27 million cases. If I get the exact figure, it says 27,893,832. This is according to Johns Hopkins University and also the World Health Organization. However, the death rate is 904,333 as of literally 5 minutes ago, which puts us at less than 1 million deaths out of 7.2 billion people. How do you respond to that?
Denise, you want to take it or you want me to go?
Yeah. So, no, go ahead.
So I think the first data point, the 27 million, are the positive cases based on the tests that have been done. And so
Correct.
There's probably less than 400 million individuals globally that have been tested. So if you do the ratio on the 7.8 billion, it's less than 5% of the population, close to 5% of the population being tested. So the death rate should really be assessed on the total number of infected individual, and not knowing the number of asymptomatic, then we don't have a really good understanding of the exact death rate, I would say statistically. Having said that, the more important question is what are the long-term consequences of someone that contracted COVID and is today asymptomatic? It could develop a cardiovascular issue later on, etc. So I'm not saying that this is a flu, as there's few people saying out there, but it's certainly important to have a deep understanding of the data in order to, have the right approach in combating this challenge.
Dennis, you have a reflection on the comparative numbers?
Yeah, I think people focus. I mean, the death is what is the sad reality and the sad immediate reality. But as Gianluca was saying, the focus on this particular number is unhealthy because it really neglects all the long-term effects that are coming from here. So there are, the inflammation system is clearly affected by this particular disease, which means that it will have effects on other endemic diseases that are already in the population, like diabetes, for example, or heart disease, and therefore exacerbating those. We don't know what that is actually causing in terms of the long-term effect. So clearly, the aim needs to be to get as little or as few people infected from the disease. Therefore, focusing on one number over another, I think the goal needs to be that community transmission needs to be reduced.
So if I could put two scenarios to you both and ask, this is still in the area where we're trying to help our students to understand how to respond. I think we all know the general public advice is hand washing, being clean, obviously for certain high-risk individuals, staying away, isolating, and of course, distancing. These seems to be the common solutions. The Times newspaper here in the UK has a substantial piece today about the Swedish response, and I'm sure we have some of our Swedish students on. And Sweden's response is said now to be a great success. Lower cases per 100,000 than certainly Australia and, well, not Australia, but certainly the United States, much of the rest of Europe, and the high case countries like Peru and Brazil. And of course, no lockdown measures, so therefore a continuingly thriving economy. How do you look at the Swedish example? The other thing I give you is here in the UK, an assessment done of total death rates over the last 10 years shows that even with the impact of coronavirus cases added, now at 41,000 deaths in the UK, there is no significant jump in patterns of total deaths over 10 years. Do you believe, in other words, that there is too much emphasis on the deaths and not enough on other ways of thinking about this?
See, it is interesting because the answer really depends whether you're taking a short-term view versus a long-term view. In an ideal world where everything can be sorted out on the short term, then we assess the data today, and again, we may infer that a specific approach versus another is working better, and it may be true on the short term, but the genetic of the virus and the implication from a health and long-term health standpoint are still to be assessed. And so I guess the question is, are you targeting to limit the spread? Are you targeting to reach herd immunity in the quickest time? These are two different approaches, and they may lead to different outcomes, both on the short term and on the long term. And I'll let Denise comment on the more challenging question, that is, what could be the consequences for health long term if we have a higher prevalence compared to what we could with a steeper lockdown. That's something that is hard to define right now, but it's definitely a very relevant question. So it's a complex question that you're asking. Definitely we're seeing different results in terms of spreading, prevalence, but again, how many tests has Sweden done versus how many tests have been done elsewhere? It's also an indication on how to interpret those data.
Dennis?
Yeah, I think another element to that is also, so it's often thrown around that Sweden is doing particularly well in terms of the economy because they did not shut down the economy. But I think this goes back to how resilient is your economy. Like there are other means of keeping going, even in a lockdown scenario. So I think from that perspective, it really boils down to how much do we know about this virus and how much do we trust that our information that we can build these or can make these assessments on are solid. And, as a scientist, where I know that, the gold standard is peer-reviewed, independently validated results. We're just not there yet. Like, the scientists have worked incredibly hard in order to get to where we are, but we are definitely, one of the first to caution, to overinterpret the findings that we had so far. So those really put into perspective that we know very little about the virus, and all the decisions that we're making now is based on the best information that we had at this stage, but it is limited, and that we need to keep into, put into consideration as well.
So given what you've just said about, so go ahead. Yeah.
I just want to add one thing, because I think Denise makes an excellent point on the limitation of the information. And I just want to share with the Enactus students how important information, data are and will continue to be in order to be able, especially in healthcare, to manage better outbreaks, hopefully impede that those will become a pandemic in the future, and they can play a central role. But it's so important that in a digital era where we are able to produce millions of data points in a second, that we have great talent to be able to make sense of those data, statisticians, data scientists, etc. I think is a great opportunity for many students out there to make a difference in the future.
The key question, really, which is very important to the students, is, given what you were just saying, particularly Des, where would you, if you're saying to all of our Enactus students, the most accurate place for getting consistent ongoing information is where?
Yes.
What's the answer?
So it is a tricky answer, because even as scientists, where we are at the forefront of knowledge, we can't definitively rule out one thing over another. So, for example, we were looking into whether the virus is mutating in a way that causes it to be more lethal, cause it, the disease to be more severe, which is one of the critical questions. Can we, diagnose the virus? Can we swap it and say, oh, this one is the particular horrible one, this one is a mild one, and then stratify the limited health resources that we have to the one that have the bad version of the virus? But the problem is we don't have that data available. Yes, we might have 100,000 virus sequences from around the world, but this is not enough in terms of the health information that we have, the symptoms that are associated with that. It's only a fraction of those cases that we actually have the symptoms on. So the study that we've done was on 500 samples, 300 severe cases, 200 mild cases, and can we see whether there are mutations in one, in one cohort that are absent in the other? And the short answer is we've seen trends, but clearly this study was horribly underpowered. And in order to get to that kind of information, we do need to come together as a community to agree on standards of how to put that data into the system. So this is more a long-term coming together, bringing the system in place in order to be prepared for a pandemic like that. Because historically, we've never seen anything like that, where we had the ability to actually collect the data and make informed decisions on it.
So you didn't answer you didn't say the World Health Organization, you didn't say the Johns Hopkins, our students want a straight answer to a straight question. Where do they go?
Maybe I'll add, all of these sources have good data, but they need to be contextualized and they need to be understood. And the example that we were making earlier, that only a small portion of the world population has been tested, is impacting the overall statistics. So I guess each source is relevant, Johns Hopkins and the World Health Organization, and there's many others that are providing data, At the same time, it's hard to infer what is happening, taking those data at face value and not being able to interpret those data. And so my word of caution to the students is don't take data at face value, try to really understand the meaning of data. And I may add one thing, that we're all trying to focus on risk management at this stage. How do we reduce spread? How do we reduce mortality? How we drive for a better healthcare system? At the same time, and Denise highlighted it, what is the impact to the economies? And I give you an example that I heard the other day that I feel is quite interesting. We all have speed limits and different speed limits in different countries. What if we reduce the speed limits by 10 miles or 10 kilometers per hour? Would we save more lives? Most likely we would. But why we are not doing that is the impact to the society, the impact to the economy. And I think it's a good metaphor on what is happening in healthcare. Why aren't we locking down everything for 6 months in order to be done with this? It's obviously there's a lot more severe consequences to it. So when we make decision to manage risk based on data, we really need to understand the data. And I think that's the challenge right now, and what many brilliant scientists are working on 24/7 in order to get to the world and to the society a view that is comprehensive enough to make the right decision, to reduce the risk, and hopefully get past this crisis.
So
I think another concrete example is around that academic exploration of this particular, of the information space can be quite different to what is actually important for everyday life. Yes. So a specific example to that would be around whether it's airborne or not, right? So this is still, the science is still out, whether it is under general conditions airborne. It can be made airborne, which means it can linger in the air for hours and still be infectious. It can be done that under certain laboratory circumstances, but it might not be in real life. Problem though with that statement is that when it comes to the everyday life, it can still be transmitted through the air. It's not the small aerosolized particle, but it's larger droplets. But it's still different to say Ebola would be transmitted, where you do have to have contact with the actual fluids of an infected person. Therefore, I think for the everyday decisions, droplets, aerosolized, it's, it doesn't really make a difference. It is still transmitted through the air. It's just an academic differentiation.
So before I bring Joseph in, just to alert him to be ready, is what an important question. This is relevant for all of our students. Many universities are not able to have students on site, but many are having students on site. It's a very variable picture. And certainly for international students, it's a very difficult decision as to whether to travel, how to travel, can they travel. So this is not asking you something highly technical. This is asking you for your opinion, which is these wonderful next generation leaders that we have in Enactus, they want to thrive through their university time, but this pandemic has come along and pulled the rug out from under their feet a little bit. What would your advice be to them about how to thrive through coronavirus?
Yeah, so I think for me, it is, I think it is a risk budget that we should think about here, that we have a specific budget of, that we want to spend on things that are important to us and then save on things that are maybe not as important. So overall, we sort of have this net benefit of trying to reduce the spread, but we do it in one area compared to another, at least, where the risk profile might be the same. So for example, for me, here in Australia, we do have the social distancing and general hand washing and good practices in that case, but there are no restrictions like it is in Melbourne here in Sydney. Therefore, for me, it will be not going out for dinner, but going into into the office to meeting with my colleagues. I think the risk profile is probably comparable, but I do splurge on going to the office, talking to my my coworkers, but not going out for dinner. So that's the decision that I made for myself.
And for you again, Luca, what's your thought?
I think we are such a brilliant species. Humans are adaptable. We keep adapting and changing, and it takes at times generation to do that. What our students have today is an opportunity to accelerate that adaptation. And I give you an example. Everything now is digital, is virtual. It is a great opportunity, in fact, to have greater access, greater connection. So every time we face a major challenge, and this is a fundamental challenge for our society, some of these changes are here to stay, I'm convinced. And some of these changes were accelerated from COVID-19. The digital interaction, a digital world was here before, but now we all connect in Zoom, we all see each other more often even. I don't think we can keep doing only that in the future, but if we can do that and what we were doing before, I think this will be accretive for our society. So I think students have an opportunity, especially their generation, they're so agile in terms of digital thinking, digital acting and interacting digitally. There's an opportunity for them to take this and actually create some trends that will stay long term. I mean, in my own sector as well, in healthcare, great opportunity for remote diagnostic, for telehealth, and trends that we were seeing and that are accelerated from that. So if I was a student today, I would be trying to take this challenge and convert it into an opportunity in order to, your point, thrive even throughout university and maybe have even better opportunity as they look at their future, and entry in the workplace.
I mean, I would add my own additional perspective to the balance of risks and the potential of technology, which of course makes all of us a little bit either one or two dimensional, depending on how you see it. We've all become flattened literally by the experience. Is that we have to beware more the pandemic of fear than disease. And the perspective, which is important, is not to see the world and all those we know, love, treasure, respect, and need as being somehow infectious individuals that we fear. That is a very, very destructive pandemic in our wider society. So perspective is very important. And students, of course, are brilliant at doing that. So let me bring Joseph in from Nigeria. Joseph, I hope you're, there you go. You've popped up on screen. Look at that. We've added another flat dimension, but you're there with us. You've got some specific questions you want to put to our very brilliant advisors. Go ahead.
Yes, thank you, Lord Michael, and our other panelists, Dr. Bauer and John Luca. So there's some questions that are really key to us as students and alumni at Enactus, and one of them is, at Enactus, we engage in experiential learning, working closely with community members. So with the current situation around the world, how can we work closely with communities safely and support them through the pandemic?
Yeah, so as a technologist, I would say with technology. So this is really the interesting element to this, in that with technology we can reach so many different areas, and given that it's technology, it's also done, or it can be done remotely. And I think the students and the leaders that are in the audience will find that jumping into the latest and newest technology is actually something that is achievable for them. It doesn't need to, they don't need to be trained for decades and decades on something in order to make a real difference today. They can jump in and develop an app or a web page that really helps the community, that really addresses a need. And I think this is a wonderful thing of seeing the need and being able to devote your time and really addressing it.
I think, Joseph, the other thing is, think about the communities that became more digital over the last 6 months. and how you can today connect from Nigeria to a community that is in South America that may have the exact same challenges of a local community, and really enhance and expand that impact that you're having locally. I think that's something that is very powerful in a world that is globalizing. We tend to talk about globalization with a negative connotation in many instances. Actually, that would be a great example on how you can make a larger impact to communities across the globe by leveraging technology and access.
Joseph, number
Thank
two.
you very. Okay, so one of the questions is, students are asking is, we are taking courses from home, right? Now, how is the risk of COVID-19 at home any different from social distancing on campus? Is there any difference? Is it something that we should look at?
Yeah, so with the virus spreading, through droplets and infected surfaces, you can be as safe as you're trying to be with face masks, hand washing, and social distancing. There is still a residual risk that you can contract the virus. Therefore, staying at home is clearly the safest way of doing it. However, it's like the safest way of travel is through books. There is something lost in the process. And therefore, it comes back to, I think, the risk budget, in that you do need to spend it on some areas and you need to be frugal in the other areas to really maximize what you want to get out of this particular period without exacerbating the problem.
I agree. I have nothing to add, just a reminder, wear mask where you can and if you can, and it's a good practice, and wash your hands, basic hygiene, super important, whether you're home, whether you're on campus, it's important for you and it's important for others. So something that we need to keep front and central. I have my alcohol here, and we're every day and a few times a day to make sure that things are under control. So
some people would say that alcohol in the cupboard behind you used to have a different way of application. But well done, that one. So here's a question from Rowan in Australia, who says, with different groups working on the virus simultaneously, I'm assuming on a vaccine, what workflow processes are in place to make sure information is effectively shared at a global level? Are you able to help the students understand how is the sharing of information taking place? Gianluca?
Are you talking specifically around vaccines or around data on the virus?
Well, tell us, give us on both. Yeah, give us on both.
Well, there's a very large amount of collaborations happening, especially across the different academic organizations. So I would say COVID-19 is a good example on where boundaries have been overcome and different organizations have been collaborating very effectively. Obviously, we have different foundations as well being very active, like the Gates Foundation, etc., in the matter. And so there's been a good flow of information. I think it's very interesting to observe what is happening in the vaccine world. We heard recently news around AstraZeneca pausing their vaccine clinical trial to investigate the case. And so we'll see how that unfolds. But I would say a good amount of information being shared, at least across the academic world, from my vantage point. And Denise, you may have a better vantage point being heavily involved with information gathering and generating.
Yeah, so I think, the positive thing is that a lot of red tape got dropped for the purpose of knowledge gain, which is really heartening to see. There are initiatives, as you pointed out, for example, in the genomic space, there is GIS8, which now has over 100,000 genomic sequences. The European COVID Hub has the molecular information for it. And of course, the Human Host project, which links the genomic information to the symptom data. But I think, on the flip side, there is the oversharing not oversharing of data, but in terms of trying to link everything together in a way that really is more disruptive than it's helpful. Because as soon as you start sharing that information, you do need to have good practices in place. I mean, privacy and ethics is not falling to the wayside just because we have that crisis on our hand. So therefore, and there need to be some boundaries, and the talking to each other need to be negotiated. But I think at the moment we do have a good balance between the two things.
So this is a question which has literally come in the last few seconds. This is from C Moon. A UK government wants to move to venue-based testing, but this is flawed. For example, testing at sports grounds. Will the results be instantly available to prevent access? Is it not better to test away from venues first? What would your wisdom be on that? I'm sure Boris Johnson is listening keenly. He needs to hear someone. Yeah, Luca, what would you say?
Especially, I think all form of testing are helping as far as the data generated from it are used appropriately. And so you think a testing landscape, you have real-time PCR testing, highly sensitive, is the most sensitive test we have today, and is quite comprehensive. It can detect very low levels of viral load. Then you have rapid testing, is less sensitive, but you can turn that around in 15 minutes. And so it's a different use case. You, in fact, could think to test at a venue. And then you have antibody testing that is telling whether you had the virus in the past, but typically is not telling you whether you have an active infection. So I do think that the debate around when to test, how frequently as well, and where to test is a very important one, but different use cases have different requirements. And so it's very important that as we design the testing protocols for sport events, cruises, back to work, back to university, etc., we're very situational in that. And we don't take a broad brush and say, well, yes, we should test everywhere, everybody, all the time. That's not the answer.
Yes, quick answer.
Nothing to add there, beautifully said.
So I'm just going to ask you in the last 1 minute and 22 seconds of our time, that specifically again for our students, just following up on that particular question, would you think students should be tested on a daily or weekly basis?
That's a good question. Denise, do you want to start?
So
seconds.
I think in the future we'll get to a point where we can have these instant tests, and from that perspective, it is a good approach to any testing. As Gianluca was saying, any testing is helping. So, but we currently don't have the technology for that.
Yeah,
and I would ask you, Joseph. Go ahead.
I'll just add, if you can get tested,
okay,
get tested. It's important. And I would say to the university, good testing protocols are important to manage the risk and understand the risk. It's so important at a certain point to get students back to campus. So my recommendation would be get tested when you can and if you can, and social distance and follow the rules in any case.
Okay, thank you. We're out of time. Thank you, Dr. Dennis. Thank you, Gianluca. Thank you, Joseph. And thank you to the Ford Motor Company for sponsoring this very important conversation on COVID-19. Have a good rest of the day wherever you are. Thank you. Bye-bye.
Thank you.
Thank you. Bye.
Thank you.
Thank you.